Hello everyone, welcome back to Studious Students. In this video, we'll talk about oral cancer and let's begin. Let's get straight to the point and let's talk about the frequency of oral cancer in the oral cavity. It might come for MCQs, so here it is. The first one is lower lip, second one is tongue, third one is anterior floor of mouth, which is hidden by the tongue, fourth one is alveolar lingual sulcus, and fifth one is palate. Remember, this is in decreasing order, so naturally, lower lips has the highest frequency of oral cancer as compared to palate, which has the lowest frequency among the list. Now let's see the common causes of oral cancer. It is divided into strong association and weak association. Let's talk about strong association, which includes tobacco smoking and tobacco chewing. Why? Because it is common sense. Tobacco contains carcinogens. Second one is chronic alcohol consumption. Again, same. It is a carcinogen. The third one is HPV infections, which are implicated in development of oral cancer. To know more, watch my video on cervical cancer. Weak association includes jagged teeth or ill-fitting dentures. Why? Because it causes chronic mechanical irritation, which creates a constant cycle of injury, inflammation, and abnormal cell repair, which ultimately amounts to cancer. The second one is submucosa fibrosis or eating excessive chilies. The third one is poor orodental health. Why? Because it causes growth of harmful bacteria and toxic carcinogens. The fourth one is vitamin D deficiency. The main function of vitamin D is to regulate cell death and to fight chronic inflammation. Without vitamin D, precancerous cells multiply and mutate. The fifth one is exposure to radiation. It is a big carcinogen. No need to explain for this. Morphology is very important. So in this we have to remember four types. The first one is ulcerative type. It is the most frequent type and it has firm everted edges. The second one is papillary type. In this we have wart-like growth. It resembles like a glove. The third one is nodular type. It appears as slow-growing submucosal nodule. The fourth one is cirrhosis type. It infiltrates into the deeper structure. All these types may appear on a background of leukoplakia or erythroplasia of the oral mucosa. But what do you mean by leukoplakia? Leukoplakia is nothing but white spot or white plague. Erythroplasia is nothing but red spot or red plague. Moving on to histological variation, the first one we have is Verrucous carcinoma. To understand this, first we need to understand what are rete ridges. They are nothing but downward extension of epidermis into the underlying dermis. In Verrucous carcinoma, there is deep extension of this rete ridges as evident in this picture. Next is Basaloid Squamous Cell Carcinoma. Microscopically, it contains pleomorphic basaloid cells with numerous mitotic figures. A characteristic feature is abrupt keratinization, which is often highlighted in histological images and practical examinations. The third one is Adenoid Squamous Cell Carcinoma. In here, we will see adenoid spaces. But what are they? They are nothing but hollow gland-like structures that form within the tumor. The next one we have is acantholytic cells. They are malignant cancer cells that have lost their physical attachments to neighboring cells, causing them to fall apart and round up in adenoid spaces. In here, we can also see invasive tumor islands and cords. The fourth one is spindle cell carcinoma. In here, we can see hyperchromatic spindle cells, as you can see in this picture, which shows an appearance of sacromatoid. Finally, we have Adenosquamous Carcinoma. Look at this picture. What are the two things you can conclude? First one is blue dots. It's because of high NC ratio, hyperchromatic nuclei, and nuclear pleomorphism. The second one is that this image has duct-like and gland-like structures present. This is the pro table which summarizes all the important points covered in this video. You can take a screenshot if you want. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to Studio Students. See you in the next video.